Hi folks, this is Dr. Reddy, the holistic dentist, and I thought this afternoon we'll talk something about sleep apnea, the questions that lots of patients often ask me about. And sleep apnea, is treated traditionally in a sleep medicine clinic. That is the traditional way. And obviously that they are the specialists in it, and they use a capnograph and they measure it in terms of your status and the way your lung function, the way you're breathing, what we know as the anesthetists use in the theater. And there's a host of devices that are on sleep apnea machines, and every night before you sleep with the machine, and the little mask goes around your nose and covers part of your mouth, and you have got percentage of oxygen that's supposed to be intrusively infected and infiltrated. I won't say infected, but infiltrated into your whole systemic, say 7 systems of the body. Is this a solution? I'm not sure, right? But we can look at it, talk about it. Some people said, yes, it is a solution in this current day and age because there's nothing else. So sleep apnea machines is used widely. But are we treating the cause or treating the symptoms? That is often debatable, right? Many people in sleep medicine machines say that we have to provide some sort of relief for the patient. Yes, definitely. But I'm saying that let's look at it in a different way, an alternative approach, by looking at what's the cause of sleep apnea, right? What triggered the response? What triggered the severity? Is it mild? Is it more severe? And when did it start? How did it start? I think these are the questions we need to ask ourselves and ask the patients, right, on these questions, right? Is there an emotional dysfunction in the patient? Is there been a traumatic event in the patient? Has there been any interventions from a oral systemic health perspective? I think let's interrogate these aspects, right? What kind of patients come to me and ask me for my opinion on sleep apnea? Generally is that, they come to me incidentally in the discussion when I approach them and talk about what I do as a holistic dentist, right? Obviously my approaches are to be natural, non-invasive and non-intrusive, right? So in the discussion, I often set a separate appointment for them to ask them a relevant medical questionnaire. What trauma they've had, what surgery they've had, what ENT interventions they've had, what is the duration of the sleep apnea, what interventions they've used sleep apnea, have they used a sleep apnea machine before, have they used any devices in terms of help them, are they on any sleep medications, allopathic medications, in terms of natural medication. Here are the questions we often ask to the patients, right? What is your levels of energy levels in terms of your tiredness, your fatigueness? What your sleep patterns are? How many hours a day that you sleep? Are you involved in any exercise program? Are you involved in any breathing programs? These are the things that I often dialogue with my patients. But something very interesting that I found that in people who are sleep apnea, usually majority of the patients are overweight, right? They have disproportionate effect in terms of the body mass index, right? And this is a common situation, right? And the diet is often perhaps I won't call it a junk food diet, but a junk food sometimes by relation to a high carbohydrate diet. Let's discuss what the carbohydrate diet does. High carbohydrate diet often breaks into sugars. Sugars becomes what they call an relation to an acidic effects from an alkaline state. That we know that technically if you're in a healthy state you are alkaline, in an acidic state technically you are unhealthy. So that affects a few things. That it affects your sodium potassium balance in your heart function. That in turn affects your lung compliance, which we know that your lung generally the alveoli opens up every 1.5 seconds, but in people who have sleep apnea opens up about 3.5 seconds and beyond that, right? I think it's critical to understand that where this is coming from. So in my practice I found that the majority of patients who are sleep apnea related patients are, especially the adults. In fact, most of the people who come to me are adult in sleep apnea, and they are both male and females. They're not proportion to more males or females, but in my practice more males ask me the question in relation to sleep apnea. So there's a gender effect which I see in my practice. So the effect of this in terms of sleep apnea, it causes them to be restless. That is the first thing the people tell me, that they don't have a sound sleep, and though they have to use a sleep apnea machine, but it's not like a normal sleep that they have. They have often corroborate that's what you call is day naps to compensate for the restless sleep at night, right? So I think that how do we able to handle the different sleep apnea machine? So I get them to change the diet. I get them to go to a physician in terms of get the body mass index corrected, right? And the critical factor is that to ensure that we exclude any ear, nose and throat problems, right? And to have a general medical physical to ensure that they are in the optimal state of health. So what is alternative approaches in this? So I mentioned about a healthy diet, which is critical, what you call the low carb diet, right? The second thing that to trace any allergies, allergic reactions they have in relation to food additives, or whether it's in terms of vitamin, make sure they're not prone to asthmatic effects or any other allergics that they may have in terms of external factor, what they call epigenetic factors. So the breathing issue, we found that it to be central in relation to the posture. So we find that in people who have sleep apnea, they have a disproportionate posture. And what do I mean by that? If you watch a sleep apnea patient, besides being overweight, he has a rounded shoulders, right? He tends to have a more a curved spine, right? And if you put him straight in terms of perpendicular to the wall, you find that his proportion to his left to the right side or right to left side is disproportionate, right? So we get them on a program either to use biokinetics, or sometimes we send them to a chiropractor, sometimes we send them to a rolfer. So what's a rolfer? Rolfer is about working at a cellular tissue, removing the endotoxins at a cell level. So they remove the toxins at the cell tissue and the muscle and the soft tissue, and then we know that we straighten up the skeleton. So what's the science behind this? We know that in birth and in science of creation, the first thing you see on the scan the baby is born, you see soft tissue, then you see hard tissue. So if you get the function of the soft tissue right, you get the hard tissue corrected. So we find that when you get the proportions of the skeletal effect to be proportionate and perpendicular to the force of gravity, they straighten up. When you straighten up your spine, you find that your shoulders straighten up and your lung compliance increases, and we optimize that effect by what you call is nasal breathing. And one of the things that we do is alternative nostril breathing. There are lots of things on YouTube that you can go and you research that. So we get to profoundly relate themselves to their breathing function to ensure that you optimize your nasal breathing more than your mouth breathing, right? Now, what is the effect in terms of energy levels that will be or sustaining of this kind of effect I mentioned? Now, there's an analogy that affected the people who do mountain climbing, Mount Everest, do the Kilimanjaro, whereby they breathe effectively but with the slowest effect. That means they don't breathe with the gasping effect as rabbits and dogs. We know the rabbits and dogs breathe in a gasping effect and their lifespan is less. Therefore, in human beings, we breathe slowly with the most profound effect. Your lifestyle is obviously increases, and therefore we know that people who accomplish Mount Everest and Mount Kilimanjaro are the people who breathe effectively but breathe with the most silent effects in terms of nasal to mouth breathing, in terms of inhalation and exhalation with the correct patterns. So the three things important in this aspect. We need oxygen, we need carbon dioxide, we need nitric oxide. So we don't only need oxygen, so we don't need to be ventilated, we don't only need oxygen concentrators, right, to ensure that we are optimizing our health. But we need nasal breathing, because as I said in my previous videos, that the nasal passage is the only passage in the body that has a nitric oxide. So when you breathe effectively to the nose, that the nitric oxide affects the purification of the air and you breathe optimal pure oxygen. So that's what in my approach that I would do in terms of integrated health, what we call oral systemic health, and that's how I'm approaching sleep apnea patients. I won't say that there is total results of it, but I can see some trajectory or reversal of people of dependence on sleep apnea machine, but to be dependent on themselves without machinery. Thank you very much for listening and look forward to engaging you soon.